All right, hello, welcome to chapter 20. So this section right here, we're going to be starting the immunological, hematological, and organ failure section. And so chapter 20 will cover two diseases that are different from each other, but relatively similar when it comes to exercise, and that's chronic kidney and liver disease. So let's jump right into it. So, the overview in general is that kidney and liver diseases impact most metabolic processes that provide nourishment to all cells. Now, that means that when these diseases start to take course, and especially when they get to their advanced stages and end stages, it impacts all cells, right? So, it's very serious. And specifically for how it's treated, the health system fosters an environment that facilitates inactivity and a sedentary lifestyle. So there are some concerns for, how do you keep this population away from a sedentary lifestyle when this is kind of how the treatment is set up at the moment. And it doesn't get as much media attention as other conditions like the cardiovascular conditions, like cancer, like um, high blood pressure. However, it provides a very challenging problem for exercise professionals to address. It's a unique setup of how complicated it can be. So, with that said, why don't we jump into um, the pathophysiology and the management. So we'll start with renal disease first, and we're going to call this CKD from now on, chronic kidney disease. So it's a progressive deterioration of the filtration functions of the kidney. Now, some common etiologies are uncontrolled hypertension, diabetes, genetic risk factors, congenital conditions, and autoimmune diseases. Now, early stage treatment is usually focused on blood pressure, diet, and anemia. So, lowering blood pressure, controlling the diet, and whatnot. And at the late stage, the two options are dialysis and transplantation. Um, so yeah, and some symptoms that people with renal disease experience are fatigue, nausea, and anorexia, and insomnia. Now, an interesting thing about kidney disease is people actually don't really feel the full effects of having, kidney disease until about 80% of kidney function has been lost. So I mean that's a significant amount. Like the kidneys are so efficient with how they filter everything that comes into it, filtration, producing urine, so on and so forth, that 80% of its function has to decrease before people actually feel that something is wrong. Now, some major consequences of CKD is, first of all, fluid retention. Um, this causes circulatory congestion, and that causes, high blood pressure and whatnot. And the second major consequence is soluble and insoluble compounds built up in body fluids. Now, what this leads to is extreme hypertension, fluid overload, which then can lead to heart failure, endocrine abnormalities, anemia, and increased levels of chronic inflammation and oxidative stress. Also, a note here for CKD. People in this category are in the highest risk for developing atherosclerotic cardiovascular disease because as they develop this extreme hypertension from all that fluid that gets retained and the soluble compounds as well, that leads to a hypertrophy of the left ventricle of the heart. And interestingly, as the book notes, people with CKD, about 70% of them will actually die before getting to end-stage renal disease because of cardiovascular problems. So they probably have a heart attack. So it's not actually renal disease that ends up, unfortunately, killing them. So that kind of hints at where the exercise is going to be focused for this group and what the treatments are going to be focused on. But for the time being, let's also talk about liver disease because it is different, right? So it's either hepatitis or liver inflammation, and it can occur from bile obstruction or cholestasis, blood flow changes, and toxic injury from alcohol, medications, and drugs. Now, unlike kidney disease, this can only be medically managed and not cured. And specifically, there are no artificial replacement therapies available. So, of course, kidney transplant exists, liver transplant exists. However, for the kidney disease, you can have dialysis to try and help out without the transplantation. there's no such thing for liver disease. So that's the main difference between the two in terms of treatment. Now, liver dysfunction affects the digestion of food, glucose regulation, clotting, metabolism of medications, and the conversion of waste products into urea. So some medications that these populations take, a lot of them we've talked about, but I just want to, count them here in case someone's out there taking notes for this. For kidney disease, usually people get prescribed diuretics, ACE inhibitors, angiotensin receptor blockers, and alpha adrenergic blockers. And then for liver disease, they usually take antiviral treatments for hepatitis specifically, medications to reduce protein absorption, and diuretics again. All right, so how do these two conditions affect the exercise response? Now, even though the conditions are different, they actually have a really similar um, effect when it comes to exercise. So, what we see is a marked reduction in exercise capacity due to diminished muscular strength as the disease progresses, early onset of fatigue, and low maximal heart rates. And in general, we see an overall reduction in physical activity as our overview talked about. But what we do see is that after liver or kidney transplantation, exercise capacity does improve quite a bit. However, only if appropriate rehabilitation was given. And if it hasn't, then this population does not match their age controls for people who, don't have liver or kidney disease. So rehab is very important, and it would be good to understand exactly what someone's rehab process was after transplantation. Now, regarding exercise testing, this is one of those scenarios, one of those chronic conditions where it may not be helpful, but it's two-sided, right? So for some people it may be helpful, some people it may not be. Now, the main reason it isn't helpful for this population are four reasons. So first one, as we talked about with some other populations, with the severely deconditioned populations, um, many stop exercising before reaching 85% of their maximal heart rate. And if you don't get to that, as we know in this field, you don't really yield anything useful from the test, so why even do it in the first place, right? Second, because of that left ventricle hypertrophy we talked about for the kidney population, that's actually going to give you some different ECG readings. So interpreting the ECG is not going to be as helpful. Often these populations have electrolyte abnormalities that will also affect the ECG readings. And lastly, they exhibit significant muscle limitations. So, when you're exercise testing, you want to know what's happening metabolically, cardiovascularly, but if their muscles aren't letting them get to that point, then again, what's the point of doing an exercise test? However, this isn't saying don't do it at all. It depends on the person, right? So if you are going to test a patient, it can yield some useful information. But note the following, um, I guess, considerations. So use a treadmill or cycle ergometer at very low work rates and progression. So just start really slow with them. Many CKD tests are terminated due to systolic blood pressure greater than 250. Um, so definitely watch for that. If your patient, if you know they have severe hypertension, it's probably not a good idea to do it in the first place. Liver transplant recipients with portal hypertension should avoid maximal exertion. Now, this specifically is because they can experience something called variceal bleeding, and that's like bleeding that happens in the esophagus with exertion, and it can be really dangerous. So that's a contraindication right there. And then avoid maximal strength training and ballistic exercises for end-stage renal disease patients. And the reason for this, interestingly, is that they are at risk for spontaneous tendon avulsions and pathologic fractures. So avoid max strength testing and ballistic exercises so that doesn't happen to them. Okay, so what are the positive effects of exercise training? Well, in general, this is just like subjective metrics that people report. Both population research has shown that exercise contributes to people having more energy, less limitation in physical functioning, and improved quality of life. And frankly, we've seen this with a lot of other conditions we've talked about this semester, right? Specifically with the kidney transplant group, exercise training after that results in significant improvements in VO2 peak and muscle strength. So, all good things there. And it's not written on the slide, but you can also note that a lot of the other positives that we've noted from exercise training for other conditions are also present here. And a note for both of these populations, maybe a little bit more for CKD, just because of that cardiovascular component. Usually their comorbidities are the things that really determine how they respond to exercise training. So this is one of those populations that, yes, they have, kidney disease, they have liver disease, but depending on what other comorbidities they have, that can really impact the results. And in fact, it can impact the training. So if they're so deconditioned from all the other comorbidities that they have, then sometimes the goal isn't to improve exercise capacity, it's just to maintain general functioning and avoid deconditioning. So just note that you may see two very different people even if they have the same disease. All right, so what are some tips for exercise programming? So, for both of these groups, as functional capacity tends to be reduced, it's recommended to engage in progressive functional muscle strengthening exercises and progressive cardiovascular exercise. Consider stationary cycles during dialysis, if for the kidney population. And in general, a slower progression of intensity is advised because adaptations may occur slower than a population that doesn't have these diseases. Now, specifically for transplantation, initial low-level activity with very gradual progression, um, and the CDD4 recommendations for normal healthy adults, that is what is recommended. And for people with organ transplant that have more energy and are more apt to eventually do vigorous exercise, then that's perfectly fine. ACSM guidelines would probably be appropriate for them if they have a base of moderate training. Um, and in fact, for this population, it would be recommended to do an exercise test. But again, if they are at that level already, right? So just use your smart judgment here with that population. And now I will just leave you with a couple of general considerations for exercise programming in this population. So reduce as many barriers to physical activity as possible for this group, because again, most likely you will be dealing with people who are severely deconditioned, are older, and again, most likely have a lot of comorbidities. So, uh, yeah, reduce as many barriers as possible. Start with low intensity activities with gradual progression as tolerance improves. This is because of everything I just said, they are likely not at risk for overexerting themselves with vigorous activity. So the goal is just low intensity, moderate intensity. As I said, goal for some patients may be to prevent deconditioning rather than improve exercise capacity. And this is also tied to just how the I guess the timeline of how their condition progresses. So if they're getting hospitalized a lot, that's clearly gonna, be like deter improvements to exercise capacity. So for someone like that, preventing deconditioning is probably the best. Um, Individuals with severe muscle weakness may benefit from physical therapy before starting a cardiovascular program. So, you may be either the PT or the specialist in the CV program. I'm not sure, but just note that some people may be helpful. And then for more vigorous activities, well tolerated in persons who have developed a base of fitness through regular moderate level physical activity. And with that, we close this chapter. And yeah, hopefully this was helpful to you, and I'll see you in the next video.